Hi again, and welcome to the Paul Chandler Show. I'm your host, Paul Chandler. Tonight's discussion is the third of a three-part series over the COVID-19 pandemic, which will be discussing the telehealth codes for coders to submit on claims when providers are seeing patients, usually from their home, while the provider is in the office, using telehealth or telemedicine. We'll come back after this moment and begin the process of the decoding discussion. And we're coding with part 3 of our 3-part series on COVID-19, talking about telehealth and telemedicine for CPT and HIPAA coding. And there's 4 major parts that we'll be discussing. One is the telehealth and the telemedicine, the live aspect of it, then also virtual check-ins and e-visits, and then also visits over the telephone. Now, so with first the telehealth, the live two-way communication, of course on a secure channel, but that is when audio and visual are both being exchanged. Like, hi, right now, you're watching me on your screen, but say something. Yeah, I had no idea what you said, because I can't hear you. I cannot hear you, nor can I see you right now. So that is not an example of telehealth. So the telehealth is the live two-way communication back and forth, and programs that, not saying that they're HIPAA compliant, but are commonly used, for example, FaceTime for Apple products, or GoToMeeting, or Zoom even. That's an example of the live two-way audio and visual. So as far as the coding for it, then it does depend on place of service. So with the telehealth codes, and these codes have already been existent, so these are not new for COVID-19, but we have, based on the telehealth side, we have, if it's the office 99201 through 99205, the codes that we have just come to love and we code quite often. So those are the ranges that's done in the office. Or if it's on for Medicare, then we also have the G code series. If the place of service involves, if it's a consult, it's conducted in the emergency department, inpatient, or also the skilled nursing facility. And those are being time-based. So then we have the G0425, G0426, and G0427. So, and I'll just do a black line here to separate those. So it goes for here, again, we're dealing on the consults, the emergency department, inpatient, and SNFs, the skilled nursing facility. And then the times based on these, G0425 would be equivalent to 30 minutes. G0426 equivalent for 50 minutes, and G0427 equivalent for 70 minutes. So while all these codes have already been in existence before COVID-19, some codes though that we are using possibly more often right now are virtual check-ins. And these are simply just quick few moments back and forth. So the phrase virtual check-in, the 2 codes that we use are based on, is it a live virtual check-in, again, live two-way communication back and forth, or is it a recorded virtual check-in? And those 2 codes that we have, and separate those out, we have G2012 and G2010. So G2012, that's the live virtual check-in. And that's approximately 5 to 10 minutes. Just like a quick phone call where it's the two-way system even, because that does include in the code, but then also the live virtual back and forth. Or the G2010 where it is recorded. So that is, think of it as like on demand, where you can watch something live on TV, that'd be like the G2012, or if you're streaming something on demand, for example, Now, I'm not saying, hey, the doctor gets to watch Netflix or Hulu or whatever one of the bazillion streaming services we have nowadays. That's not what I mean by as far as the G2010 being recorded, but it's a recorded message that the patient sent to the provider, and then the doctor's able to view it whenever he or she is available to. So those are the two so far of the 4 different variations that we have as far as codes. Again, the telehealth, 99201 through 99215, the common codes we use all the time. If the place of service is based out for the patients in the doctor is in the office. And then the G0425, 26, and 27, resulting for consults, emergency departments, inpatient services, and SNF, skilled nursing facilities, based on either the 30, 50, or 70-minute increments. And then the virtual check-ins, G2012, if it's a live virtual check-in, in about 5 to 10 minutes. And G2010, if it's a recorded or on-demand type of virtual check-in. So while the virtual check-ins, and the key phrase there is just checking in, so it's just quick little back and forth, or the quick little recording. If the patient has more communication than back and forth, then we call that the e-visit. E as in electronic visit section. So, and this is with the e-visits through the patient portal. And what's unique about these codes is it's not per instance. It's when all the time is added together over a 7-day period. So that's something that we don't, as far as coders, we don't tend to use quite often. But with COVID-19 and how basically a lot and everything has changed, does include also communication with the providers. So e-visits through the portal over a 7-day period. Then we have 3 codes for non-Medicare and 3 codes for Medicare. So the variations are all on the number of minutes. So we have a 5 through 10 minutes, 11 through 20 minutes, and 21 minutes or more. 21 minutes and up. And then we have, again, Medicare or non-Medicare. So on the left side, I'll do the codes for non-Medicare. And on the right side, I'll do the codes for Medicare. So in this case, a non-Medicare patient for having e-visits added together through 7 days on the patient portal is 5 to 10 minutes. In the non-Medicare patient would be coded as 99421, or the Medicare patient would be coded as G20.61. Ignore the point, that's an ICD-10. Medicare would be G2061. So Medicare, G2061, non-Medicare, 99421 for 5 to 10 minutes. If it is a non-Medicare patient for a longer period of time, 11 to 20 minutes, that would be coded as 99422. And the Medicare patient, 11 to 20 minutes and a 7-day time period over the patient portal, we code it as G2062. Finally, 21 minutes or more. Then we have non-Medicare, 99423, while Medicare patient, G2063. So further with the coding, you notice though that as far as the sequencing, the non-Medicare codes are in sequential order, 994, 21, 22, 23, and Medicare sequential order also G20, 61, 62, and 63. And so this section here, again, are the e-visits, where it's all the work that the provider is doing, back and forth communication with the patient over the patient portal, cumulative over a 7-day time period. You can wear the 5 to 10 minute increments, 11 to 20, or 21 minutes and more. And then while we have also with the emerging technologies, we do have the good old-fashioned telephone visits, where it is live over the phone, but no visuals required, just audio. Pick up the good old phone, or ring, ring, rotary dial, whatever you have. So as far as the telephone, these codes, and that's one thing though too, with the coding of the telephone codes, how before COVID-19, many insurance carriers, and I borderline say most insurance carriers, did not pay the telephone codes. But with the United States, Medicare, Medicaid, and the commercials that we have, it's always good to check your providers because they may be changing the rules and making exceptions during COVID-19 to see if they'll be paying the telephone visits or not. So as far as the telephone cares, then we have the 99441, 99442, and 99443. And that's all based on how long that telephone communication is. So 99441 is for a 5 through 10 minute phone call. 99442 is for an 11 through 20 minute phone call. And 99443 is for a 21 through 30 minute phone call. So again, just to remind you though, as far as the telephone calls, yes, they've been in CPT book manual for quite some time, but double check with your insurance carriers to see if they are making exceptions to the rules and are paying these during COVID-19. So those are the CPT codes and HIPAA codes used for telehealth. Again, so today we covered the telehealth codes in general for office, consult, emergency department, inpatient, skilled nursing facility, and also the virtual check-ins, the live and recorded versions as well, the e-visits, depending on if it is a Medicare patient or non-Medicare patient, and remember that's over a 7-day time period. And then finally, last, we just kind of recovered a little bit the telephone calls that check on your insurance carrier because they may be covered now during COVID-19. And that does include part 3 of our 3-part series on COVID-19. Remember, and all of our videos are also available on demand on our YouTube channel. So check out the paulchandlershow.com. And at the top, we do have a spot where you can suggest any topics and let us know what we'd like to hear and see and learn on future videos for us. So just to recap those, since this is part 3 of the 3-part series. Part 1, we covered procedure and HIPAA coding for COVID-19. Part 2, we covered diagnosis coding. And again, part 3 today, we covered the telehealth coding. I do thank you for watching the Paul Chandler Show and have an awesome rest of your day. If you like this video and want to see more, make sure that you subscribe to our YouTube channel. It's so easy. It's right there. A little button. Just push it. Subscribe. I got all night. Nothing else to do. Just subscribe.